Today is a beautiful day, almost spring-like, you know. Fall, though, has definitely arrived, and with it, fewer hours of daylight. And the decrease in daylight hours can negatively impact mood and cause seasonal affective disorder for some people. And here to talk more about this condition is psychiatrist Dr. Joshua Weiner. Good morning. Thank you for joining us. As always, you come in and you bring us very good information. This time of year, a lot of people are starting to deal with what many people would call SAD.
Right, seasonal affective disorder. So people are kind of confused as to what this means. It's not like a watered down version of depression. Technically, seasonal affective disorder is a depressive episode that occurs in a particular time of year. So some people will experience depressions particular times of the year, whether it's the winter, fall, or the spring. This tends to be the most common time, and the reason we think this occurs during this time for some people is because of the decrease in daylight hours. So that's the hypothesis, because we know that the closer people live to the equator, where there's more hours of daylight during this time of the year, the lower levels of people suffering with this, and then as you go north or further south, the numbers increase. So in this area, roughly 5% of people will experience a true seasonal affective disorder. But of course, many more will get like that winter blues kind of feeling.
Yeah. How do you know? How do you know your symptoms are a little bit more serious than, you know, most people who just get a little down because, you know, it's darker longer?
Yeah, you know, what you're going to be looking for is just the magnitude of the effect. So if you're just kind of feeling like, I'm a little sluggish, I'm a little tired, I just want to be a couch potato and stay in, you know, that's not depression. So true depression is going to be sleep abnormalities. For most people with seasonal affective disorder, they want to sleep more. They're going to have carbohydrate craving. They're going to have decreased energy, concentration problems, low mood, crying, having maybe thoughts of suicide. All of these things taken together are going to be an indication that maybe you're dealing with this. And for most people, they just kind of know after a period of years. They might not recognize it at first, but then they realize, wow, it seems like every time this year rolls around, this time of year, I start to have these problems. That's the time that when you want to start taking proactive approaches and do some of the things we'll talk about today.
I want to get right into it because the light box treatment is something you really support.
Yes. So there are a few things that you want to do. One is you want to increase exercise. If you don't want to go out and get a true light box, you want to try to get outside as much as you can during the day. Maybe move your desk closer to a window. Vitamin D, 2,000 to 4,000 units of vitamin D daily has been shown to offer some benefits. But the treatment of choice really is this thing called a light box, which is mimicking sunlight. So what you do is you can purchase one of these on Amazon. They're about $30 to $50.
That's good.
Yeah, so not too expensive. What's great is that they tend to work very quickly. So for most people, even within a week or two, they'll start to notice benefits. And it not only helps with the mood symptoms, but it also can increase energy. The big problem is that people don't use these correctly. So what you need to do is you get one of these devices. It needs to be 10,000 lux, L-U-X. That's a measurement of light intensity. And you want to get a full spectrum light box. And you want to get one that does not have UV light, so it's not dangerous for you with your skin or your eyes, things like that. And then what you want to do is first thing in the morning, within an hour of waking up, you sit with the light box, but the key is the light box has to be roughly 1 to 2 feet from your eyes. And you have it at like the 10 o'clock or 2 o'clock position. While you're drinking your coffee, reading the paper, looking on your phone, you don't stare at the light box. So you're just sitting with it like that first thing in the morning for about 20 to 30 minutes. You do that every day, and hopefully you end up being somebody who's in that 80% response rate where you start to notice improvements within a week or two.
I love it. And people who don't have seasonal affective disorder can benefit as well.
Exactly.
I love that about it.
Exactly. So even if you're in that winter blues category, you might benefit as well.
I love it. Dr. Joshua Weiner, always bringing us some good information. Thank you so very much.
Thanks.